The federal government seems poised to shut down on October 1st unless congressional leaders can reach a deal. One of the major sticking points is the fight over renewing enhanced tax credits to offset health care coverage costs under the Affordable Care Act. Those credits were passed in 2021. They're set to expire at the end of the year, and without them, millions of Americans could see their premiums skyrocket. To help us understand the issue, we turn to Cynthia Cox, a vice president at KFF, which has analyzed the ripple effects. So, Cynthia, as you take us through this, let's start with the origin story here for these healthcare tax credits and why they're set to expire at the end of this year.
Yeah, so just as a backup story, so the Affordable Care Act, which is also known as Obamacare, always included some financial help for people who were buying their own insurance coverage. So these are people who don't get insurance through their work, like maybe they're self-employed or small business owners or employees. So they're having to buy their own insurance and they don't have an employer helping them. So the federal government was helping with some of the costs of that coverage. But for a lot of people, it was still too expensive. And there were some people who just didn't get any financial help. So these enhanced tax credits basically lower the cost of health insurance for all of the 22 million people who are buying their own health insurance and qualify for this financial help. But when that goes away at the end of this year, if Congress doesn't extend those tax credits, then what we're going to see is that the amount these folks pay for their health insurance is probably going to double. For some people, they might lose any financial help at all. Other people are still going to get some help. It's just going to be a lot less than they currently get.
The Affordable Care Act and other healthcare plans beyond are getting more expensive here. What do you make of that?
Yeah, so this is kind of a totally separate issue. There's also, it's likely that those of us who get health insurance through our work are going to see our premiums go up too. Now, that has nothing to do with these tax credits that Congress is debating right now. That is just because healthcare costs are going up a lot next year. So whether you get your insurance through the Obamacare markets or through your employer, you might be seeing that your costs are going up a lot. That's actually in large part because of hospital costs going up and also because of these popular new weight loss drugs that just cost a lot of money. A lot of people are using them, and that's driving up premiums.
So in November, what does this all mean for open enrollment?
So for people who are getting their health insurance through the Affordable Care Act or Obamacare, they're going to log in on November 1st and see that their premium payments might be doubling next year. I suspect that some people are going to make a change to their plan where they might still be able to get a lower premium, but they might have a much higher deductible. Other people are just going to look at this and think, wow, that's just too expensive for me. I can't afford to keep my health coverage. Some of them might be able to get a different job that does offer health coverage, but we're expecting that a few million more people are just going to be uninsured.